Hi friends, this is Dr. Christopher. Yesterday I spoke about the different methods of measuring obesity. So I'm sure that almost many would have already measured, and also you would have known at what BMI you are right now. So I actually told yesterday that I'll talk today about what are the problems of obesity. So as such, why we are talking about obesity so much and why we need to care about this obesity. Being obese is just a small thing, that is what people think, and I'm just fat, so what is the problem? I don't have any other problems. That is what they have in their mind. But actually, if they have any other medical conditions or any problems associated with obesity, they don't correlate that with obesity. They just think that they became sick because of the medical complications what they have been undergoing. So right now in this video, I'll explain what are the medical complications and what are the problems that are associated with obesity and what you need to be aware of. So let us start talking about these complications of obesity, maybe right from the head towards the toe. So if you start from the head, maybe in the brain, so what is the problem? So first thing what I would highlight is you are prone for, or you are having a high risk for developing a stroke. So you have twice the chance of getting stroke than the normal people who are actually in the normal weight or maybe in overweight. So after that, you are prone for dementia, which is loss of memory, and also you are prone for Alzheimer's disease. These things will be associated with other problems caused by obesity. So the next one will be you may have high cholesterol, you may have high blood pressure, and you may have high sugars in your body, which is diabetes mellitus. So because of high cholesterol and high blood pressure, you may have heart failure, and also you may have coronary artery disease. So these things are pertaining to your heart. So when you go behind that, which is the lungs. So next we will see what are the problems associated with the lungs. There are three problems, which is obstructive sleep apnea, which is caused during your sleep, which is actually a breathlessness during your sleep, which is actually dangerous if not treated. The second one will be hyperventilation syndrome, and the third one will be asthma. Asthma is developed because obesity is always triggering some kind of inflammation. So when there is a trigger of inflammation, these asthmatic attacks will be more and more. So that again puts you in breathlessness, and again it makes you in trouble. So next we move on to the gastrointestinal problems. So you are prone for getting a problem in the liver, which is called the non-alcoholic fatty liver disease, which is actually excessive accumulation of fat on the liver. And then you are prone for gallstones in the gallbladder, and then you are prone for recurrent attacks of pancreatitis, which is actually caused because of high insulin resistance, and that again leads into diabetes mellitus. And then you have something called the gastroesophageal reflux disease. What happens is, whatever you eat, because of high pressure in the abdomen, what happens is whatever you eat is pushed up. So that is called the gastroesophageal reflux disease, which causes heartburn, and again it causes acid reflux. So they don't have a proper digestion, and at the same time they feel this as one of the problem, which again leads to esophageal cancer in the future. So next is the kidney problem. The kidney is actually supposed to be infected, and it can even go to end stage kidney disease or a kidney failure, and then it is also prone for a kidney stone. So whenever you are obese, the chances of going for a renal failure is more as compared to a normal person. And then we have low immunity when we are obese. So when the immunity level is very low, what happens is we are prone for more infections like urinary tract infection, surgical infection, or nosocomial or hospital infection. So when we come into fertility, in men, obesity is associated with the reduced sperm motility and also erectile dysfunction. So that causes infertility in case of a male. And at the same time, in female, it is associated with the PCOS, which is called polycystic ovarian disease. It is also associated with the loss of pregnancy. So all these things are because of obesity. So whenever you are overweight or obese, don't think that the infertility issues is because of other causes. It is mainly because of obesity. So next one is the psychosocial problems. When you are obese, you are tend to have more of depression. You have been bullied everywhere. You will not be welcomed in your workplace, and you will have so much of stress in you because you're obese. You are not accepted properly in the society. So all these things make you more and more into a depression, and that is also because of obesity. When you look into the musculoskeletal problems, you will have low backache, and at the same time you will have neck pain, and also you are prone for osteoarthritis. And most commonly, the main thing what obesity is linked is with cancer. There are many types of cancers possible when you are obese. You are prone for getting a colon cancer in case of male. You are prone for getting breast cancer, uterus cancer, and ovarian cancer in case you are a female. And also you are prone for getting cancers in the pancreas and also in the gallbladder, and so on. So cancer is also because of obesity. You don't think that obesity is just a normal problem. It is a disease, as I told you, and it needs to be treated, and it needs to be treated at the right time to get the right result. So apart from this, there is a one major thing which is going on right now, which is COVID-19. COVID-19 again is more infective in case you are obese. So always be careful. When you are overweight or your BMI is more than 30, you are prone for getting COVID-19 as much, twice as possible than others. So always beware of what you are eating and always beware of what you are doing. So in this video, you would have got an idea about what are the problems and complications of obesity. So I am stressing again that obesity is not just the way we think, it is way beyond, and it is associated with many problems, and even the lifespan is also decreased when we are obese. And also there are many deaths reported because of obesity. So thinking that obesity is not just a issue of being overweight or having more fat, it is actually more than that. So in my next video, I'll talk about what is the problem of obesity right now in India and at the same time in the world. So keep watching. Till then, it's bye from Dr. Christopher.